Good, so we're talking about the pelvic tilt and how it helps alleviate your back pain in pregnancy. So if you have purchased one of these fitness ball or birthing balls and you are using it at work, what I meant to say in the blog, in the writing, is that you can just keep slow motion, slow or fast, small motions back and forth in this way or side to side. The only thing you need to make sure of is that your feet are flat on the ground and your knees make a 90-degree angle. And you can also do those little circles, and once you get more comfortable with it, you can kind of go a little wider. You can make them very small. It still moves your hips and use all the muscles of that midsections back and forth. And just when you type or write, or if you would answer the phone, all those tasks that we used to do sitting still, then you have that kind of easy way of keeping your hips in motion. And I'm going to show you what it looks like from the side. So your feet are flat on the ground and the knee makes a nice 90-degree angle, and you can do those little motions, arching and bringing, what I call bringing your baby closer to your spine, is when you roll your hips under like this. And side to side, or make the little circles. And again, when you are at home and you can get into, you really can get into it and play with it, the more comfortable you become with it, it's a very nice way to keep your joints and your muscles in the pelvis engaged and moving nicely. Now we talked about using the pelvic tilt when you are standing up, like standing up in the line at the post office or at the grocery store, and always having a mind of its own here. So usually we sit and carrying the baby. This is my borrowed baby. And carrying your baby, and you kind of let your baby pull your body forward, and you may see other pregnant women kind of stand like that. And if you do that all day, it really strains your back. So the pelvic tilt when you're standing up feels like you really bring the curve of your tailbone under, and it pulls the baby a little closer to your spine. You can do that bending your knees a little bit, but your back becomes aligned and your muscles are not straining anymore. The legs are working hard, but that's good because you can build the muscles in your leg. If you have difficulty finding the pelvic tilt, I can keep the baby here. What you're going to do is put one foot in front of you, and when you don't pay attention and you relax, usually your back makes that nice curve, but that also would create a strain if you stay for a long period of time, and your baby's weight would pull this way, so it pulls on the back muscles too. So if you push on your knee and do this motion of tilting your pelvis under, and it tightens the quad muscle in your thigh, that is a pelvic tilt, and it's a nice way to find out and notice how it feels like, and you can make a mental bookmark and remember what it feels like. It's a good exercise too. So practice your pelvic tilt and you will save your back.